Bismillahirrahmanirrahim. Assalamu alaikum everyone. This is Hamza Hussain and welcome to Pakistan Cardiac Super League Season 2 presented to you by Pakistan Cardiac Society and powered by Wilson's Pharmaceuticals. Today we are live for the 12th match which is going to be held between Civil Hospital Falcons versus L.R.H Jaguars. L.R.H Jaguars are entering for the first time. Even Civil Falcons are also the first team of this season. They were not present in the season with both of the teams. Regarding the current position of the group, Civil Falcons have already won their first league match and they are on the top of this group with 2 points, while AFIC and have lost their first match and Jaguars are going to play their first match. And Civil Hospital, by winning this match, can qualify for the Super Six stage. And with this, allow me to introduce the senior faculty members who have joined us today with their presence. We have with us the one and only Professor Mohammad Isaac Saab. His enduring commitment, his strong commitment with this is important. It's played an important role in the success of this league. And we are very thankful to Professor Mohammad Isaac Saab for joining us today as a match umpire. Second match umpire is Professor Abdul Hamid Siddiqui Saab. He's professor of cardiology at AFIC, former professor of cardiology at AFIC Rawalpindi. And we have also have today guest panelists with us. We have with us Professor Mansoor Ahmed Saab, a renowned cardiologist of Karachi. He has also joined us today as a guest panelist. Alongside with him is Professor Charag Hussain Saab. He's head of department, Hayatabad Medical Complex. And we have also with us Assistant Professor Malik Faisal Saab. He is a team mentor of L.R.H Jaguars. And last but not the least, I would like to introduce the panelist, Dr. Hamza Gori. He is going to moderate this program, this 12th match. Dr. Hamza Gori is working as an assistant professor of cardiology at RSC. I will now hand over the mic towards Dr. Hamza Gori sir to start the formal proceeding of this match.
Thank you very much, Hamza. So we are back again to the second season of Pakistan Cardiac Super League in collaboration with Pakistan Cardiac Society and Wilson's Pharmaceutical. So we're back to the most exciting part of the day. We've had some very interesting games very recently, and I hope today's match is going to be at level with the matches that we've had so far. And for today's game, we have a tough match between L.R.H Jaguars versus Civil Falcons. And let's see, because now we are moving towards the closing stages of our league matches and it's getting more and more interesting. I would also like to take this opportunity to welcome our panel of experts. We have Professor Mansoor Ahmed with us. Welcome, sir. We have Professor Charag Hussain. We also have Assistant Professor Malik Faisal, and definitely our umpires who are always there to guide us and support us. We have Professor Mohammad Isaac Saab. Welcome, sir. And we have Professor Abdul Hamid Siddiqui, who will be joining us. And as we have more panel members, we will have the introductions as they come. So with this, we move to the two teams, and I will request the two teams and their captains to give the introductions. And I will randomly ask Civil Falcons and their captain to give the introduction.
Assalamu alaikum. I am Dr. Mohammad Fad, team captain of the team Civil Falcons, and on my right is Dr. Aima, and on my left is Dr. Samina. Unfortunately, we don't have fourth member right now due to some personal issues, and we wish the best of luck to the other team too.
So most welcome. I think it's going to be a good game. Best of luck to you, and I hope you'll be able to give a good fight. And let's see how it goes. And now we move to L.R.H Jaguars. Captain, to give the introductions, please.
Assalamu alaikum. Sir, I am Dr. Hassan Ali and representing the L.R.H Jaguars. On my right side is my junior colleague, Dr. Hafsa Liaquat. To my left is Dr. Adnan Shah, and next to him is Dr. Majid.
Thank you very much, and best of luck for the game today. I think it's going to be a high-scoring game because the pitch seems to be good and the weather is warm and good. So, with this, we move to the all-important coin toss, which is going to be electronically done. So, either it's going to be heads or tails, and I'm going to randomly ask L.R.H Jaguars to please call it. Okay, so I've heard heads. Okay, and yes, it isn't heads, it's tails. All right, so the news is Civil Falcons have won the toss and I'm just going to pose them with two questions. The first one is whether they want to take the questions or they want to throw the questions. Can we have them on the screen, please?
Well, we would like to throw the questions.
Okay, so you would like to throw the questions, and the second question is you have two sets of questions, two scenarios.
We would like to go with the A.
Can you read the question?
35 years old squash player with a history of hypertension and asthma presented in the emergency department with complaints of crushing central chest pain for 3 hours duration along with the apprehension. On examination, he is anxious looking with a heart rate of 120 beats per minute. BP is 180-110. Chest examination is unremarkable. Auscultation reveals ejection systolic murmur at aortic area and a pan-systolic murmur at the mitral area.
Okay, so you will have just a couple of seconds to gather yourself, and then we'll move to question number 1. All right, so can we have the first question, please, on the screen? Read question number 1, please.
Okay, what is the next most appropriate investigation to carry out? ECG, echo, chest X-ray.
So in the meanwhile, I'm just going to read the question quickly. So what is the next most appropriate investigation to carry out? Option A is ECG, option B is echo, option C is chest X-ray, option D is 2D echo, and option E is CT angio. And your timer, which is 60 seconds, start now. Okay, the team answering, we would like to see them on the screen. Can we have them on the screen? Okay, so less than 30 seconds now. Come on. You're approaching 15 seconds.
Sir, it's option D.
Option D?
Yes, sir.
D for Delta, 2D echo.
Yes, sir.
Should I lock it?
Yes, sir.
Okay, so lock option D, please. Oh, so we've missed the first one. Never mind. I'm sure the next one is going to be a big one, a big 6. All right. Can we have question number 2 on the screen, please? Read the question.
ECG is done, which shows Q waves in inferior and lateral
Recording
leads.
in progress.
Which of the following is true regarding waves of hypertrophic cardiomyopathy?
So option A, lateral Q waves are more common in HCM as compared to inferior Q waves. Option B, inferior Q waves are more common in HCM as compared to lateral Q waves. Option C, septal Q waves in HCM are more than 40 milliseconds. Option D, A plus C. And option E is none of the above. Your timer starts now, 60 seconds.
None of the above.
Okay, we are approaching 10 seconds. Come on.
Sir, option D.
Option D, Delta. Are you sure? Should I lock option D for Delta?
Yes,
A
sir.
plus C. Jaguars, you want me to lock it?
Yes, sir.
Okay, so lock option D, please. Oh, goodness. Another outswinger. You didn't even come close to it. All right. Well, you need to buckle up. Moving to question number 3 now.
A detailed inspection of the neck of the patient reveals raised JVP. Which of the following features will be expected in the patient's JVP examination, keeping in mind that the clinical diagnosis is hypertrophic cardiomyopathy? Prominent A wave, prominent V wave, prominent X descent, prominent Y descent, and none of the above.
And your timer starts now. Less than 20 seconds. Come on, Jaguars.
आप उनको बताओ
5 seconds. Come on.
Option C.
3, 2. Right, I couldn't hear anything.
Option C. Sir, option C.
Okay, but we couldn't hear you, and I will request the umpires to guide me on this one.
Sir, option C.
Okay, so Sir Isaac, are you there? I think they were trying to speak, but we couldn't hear them. Should we give it to them? Okay, so do we have Dr. Abdul Hamid Siddiqui? Any of the umpires who's there? Okay. So which option have you chosen? Option C?
C.
C for cat?
For
Okay. So I think let's lock option C. Oh, even though we had some technical issue, we couldn't hear you, but I think you were trying to speak well within 3 seconds. But again, it's a hat trick of misses. Come on, Jaguars. Pick it up. So, can we have question number 4 on the screen, please? Read the question, Falcons.
Palpation of the precordium of the patient reveals the 3-component apical impulse. What is the reason of component of the apical impulse? Early systolic bulge of the LV, late systolic bulge of LV, early diastolic bulge of LV, late systolic bulge of LV. None of the above.
Okay, so your timer starts now, and I will request you to state the options also, whether it's option A, B, C, D, or E. Thank you. So you have 60 seconds. Come on, you're still not on the board. And I would also like to take this opportunity to welcome Professor Dr. Jabbar Ali. Welcome to the show, sir. Come on, approaching 10 seconds now. Hurry up. 7, 6.
Sir, option C.
Option C. So they want us to lock option C, early diastolic bulge of LV. Let's see. Lock option C then. Oh my goodness. That's another one. Lost. All right. So 4 in a row now. Question number 5. Come on. You can do it. Can we have it on the screen, please? Read the question, Falcons.
What will be the effect of post-Valsalva release on the intensity of the murmur? Murmur will increase because of the increase in LV volume. Murmur will decrease because of increase in LV volume. Murmur will increase because of decrease in LV volume. Murmur will decrease because of decrease in LV volume. None of the above.
All right, your timer, 60 seconds, start now.
Option D.
20 seconds.
Option D.
Are you sure you want me to lock option D? D for Delta. Okay, although we can't hear you that well, technical team to look into it. So just lock option D, please. Oh no! Goodness, that's 5 in a row. Half the questions are gone. You're left with 5 more questions. You have to play it very sensibly now. Moving to question number 6. Read the question, Falcons.
Bedside echo is done. Yes, sir. Bedside echo is done, which shows EF of 60%. Interventricular septum measuring 16 mm, resting LVOT gradient of 30.5 mm mercury and provocable gradient of 52 mm mercury. LV and diastolic diameter of 48 mm and LA diameter of 41 mm. Which of the above mentioned parameters support athetic hypertrophy over SCM? IVS measurement, resting gradient, provocable gradient, LV and diastolic dimension, LA diameter. Over to you.
All right, the timer starts now. 60 seconds. Okay, I would like to welcome. All right, we can hear some crosstalk, so I would request everyone to please keep the mics on mute, except for the team which is answering. Thank you. And I'd like to welcome Professor Dr. Abdul Rauf to the show. Welcome, sir. And I would also request you to please keep your mic on mute. We can hear you. So, 15 seconds to go. Hurry up. 10 seconds. 7. Come on. 5.
Option C.
All right. Option C. They want us to lock option C, provocable gradient, right? So, lock option C. Oh no! That's the 6th one. All right.
Hamza, what's a bad day today?
Seems to be a difficult one. Even we haven't witnessed it so far, but we can only encourage them to hope for the best and give it their best. Right. So, can we have question number 7? Read, please.
To manage this patient in the ER, which of the following medication will you administer? Beta blocker, calcium channel blocker, nitrates, beta blocker and nitrates, calcium channel blocker and nitrates.
And 60 seconds start now.
Option A.
That's very quick. You still have 50 seconds. Are you sure? You can take your time. Ishaq Saab would definitely guide you on that.
Option A.
A alpha, that means beta blockers. You want me to lock it? Yes?
Yes, sir.
All right, lock option A then. Oh my goodness! As sure as they were. That's another one missed. All right. So, we still have 3 more questions to go. Come on. Can we have Question number 8 on the screen, please. Read the question.
Which of the following is the strongest predictor of sudden cardiac death? Prior history of sustained ventricular arrhythmia, prior history of sustained ventricular arrhythmias, non-sustained ventricular arrhythmias, unexplained syncope, family history of sudden cardiac death, and hypertensive group in ET.
All right, your 60 seconds are on your
In
screen.
ETT.
That's hypotensive drop in ETT. That's option E. All right. Jaguars, play wisely. Twenty-five seconds.
D.
Which option? D delta or B beta?
D delta.
D delta. Okay. So they want us to lock option D. Lock option D delta, please. Oh, no. Another one missed. Well, this was question number 8. So we are going to move to the second last question of the innings, which is question number 9. On your screen, read it please.
The patient undergoes cardiac catheterization that shows Brokerberg-Brownwald effect. What is the mechanism of the said phenomenon? Increase in contractility and increase in afterload in the PVC. Increase in contractility and decrease in afterload
In the post PVC beat, yes.
Third one is increase in contractility and increase in preload in the
Post PVC beat.
Something. Post PVC beat. Increase in contractility and decrease in preload in the PVC beat, and none of the above.
All right, your 60 seconds are on your screen.
Option D.
B for beta. Okay, I can't hear you properly. Option B, please come close to the mic and speak.
Option D.
Option D, D delta. Okay, so are you guessing it or are you sure? Okay, so they have said option D. They want us to lock option D delta. Lock it, please. Oh, well, 9 questions, 9 misses. So, moving to the last question of the innings. Question number 10. On your screen, read it, please.
Yes, mavacaptan is now known to be of benefit in hypertrophic cardiomyopathy. What is the mechanism of action of mavacaptan? Reduces ATPase activity in the myosin heavy chain, increases ATPase activity in myosin heavy chain, reduces ADPase activity in myosin heavy chain, increases ADPase activity in the myosin heavy chain, reduces ATPase activity in the myosin light chain. Over to you.
All right, 60 seconds are on your screen. We are all hoping for Jaguars to be on the board. Approaching 20 seconds. Come on, Jaguars. 15. Okay, so you want us to lock option C. C for cat, right? Reduces ADPase activity in myosin heavy chain. All right. So lock option C. Oh my God. So we have lost the last one as well. And unfortunately, L.R.H Jaguars have not been able to put up a score, any kind of score on the board. And they've missed all the 10 questions. So, well, I guess it's going to be a difficult ride from here on. And I would definitely like to take the experts on board. We have our umpire, Professor Ishaq Saab. Sir, your comments.
Well, thank you very much, Hamza. I'm a bit depressed today and reminds me of in the past on one particular day, we had 4 or 5 FCPS candidates, and I and Professor Ashfaq, late Ashfaq Khan, we were examining, and none of the candidates passed, and we both decided that we will be coming to examine again. So we are so depressed. So I have the same feeling today that the score is 0. We should not have been. The question, you see, there were 1 or 2 questions where I, on review, thought that the answer may be different, but then they were supported by literature, by evidence from various books and references were there. So I would like the worthy panelists, my colleagues, today we have a bunch of experts sitting. If they want, they can review this question, whether the question was difficult or the answers were wrong, so that the team could not score a single, answer correctly. So I don't know. I mean, I'm a bit disappointed today. And secondly, today we had difficulties in our audiovisual as well. So that should not happen because that uh, disturbs the teams and their thought process as well. So I think these are my comments, and let's see what the other team does. But naturally, it's going to be a one-sided match today, and I feel sorry for L.R.H. They should not be discouraged. Uh, they should continue with their efforts, improve themselves. This is a learning experience, and this is a knowledge competition, and we should keep it at that level. We shouldn't become personal or should not become depressed or discouraged. So I think if any of the worthy panelists have any comments about the question, we can forward the question to them with the references. But I think definitely the team was not well prepared.
Right, sir. Thank you very much for your valuable comments, like always. And I think I would second your thoughts. And we did have some technical issues, but at the end of the day, the whole team was able to put it together. It does affect the team, no doubt. But the teams, they really have to give it their best, and you need preparation for such competitions. And I'm sure
And
they'll
Hamza,
come back.
Hamza, let me repeat my suggestion that I gave last time, that
Sir.
we should have printout of these questions and answers, and we should provide the printouts to the team for ready reference. And because sometimes they can't see the screen properly, they are in a hurry, and if we have printout in front of them, that will make things easy for them.
Very right, sir.
So
I'll
I've asked
definitely.
Wilson to provide this from next time.
Very right, sir. I'll also request the technical team of Wilson and the administration to look into it, and I think they must have a backup in similar fashion. So with this, I move to Assistant Professor Dr. Malik Faisal. I think he's the mentor of L.R.H Jaguars. Is he there with us? Can we have his comments?
Hello, Dr. Hamza. Thank you very much. The team performance was really disappointing. There's no doubt about that. But there's a few things that I want to add for this competition too. There are 3-4 questions, like Professor Sachs have said, that the answer could have been different. Even the literature and everything does not support that answer that we can discuss, and even the quality of that MCQs for that matter. But one of the MCQ that I remember, that was about the ejection systolic murmur. Both the option was repeated. So when you have an MCQ and both the options are repeated, option B and C were the same, and then there was also some spelling mistakes on that. And the other thing that really disturbed, I guess, that the team found it difficult, was that the scenario was, when the scenario was displaying and the other team was narrating the scenario, it was not displayed on the screen. You could see at that time the person who is talking or the person who is reading the scenario, and there was breakage in that voice at that time. So at that time you could not hear or see the scenario by yourself. So I suggest that it should be that the screen should have been a split screen, or if the person is reading that the screen of the scenario that has been projected should be locked and pinned up, and then the scenario is taken there, because it is a multi-end question and a first question leads to all the questions. So it is basically the scenario is from the first question. So scenario should be pinned up, and then it should be in regular continuation with that. Otherwise, the team was there. They gave their best, whatever they could do. We are not disappointed, and we are ready for any other competition. And the team will be there. And I congratulate them at least to participating in the competition. And yes, the performance was not up to the mark and up to the standards. But these are a few comments from my side about the whole competition.
Right. So thank you very much, sir. I think your input is extremely valuable for us, and you're absolutely right. And we've had multiple sessions already, and I totally agree with you that once you're having these questions, and we've now ensured that the whole scenario is available on the other screen. I think the technical team has just told me that the scenario was available to them over there. I think we can counter check that as well. Unfortunately, I think you were unable to see it on your screen since maybe it was not pinned up. So, so this is one aspect. And as regards the questions, so there is a whole system behind it. We have a team which forms it. Then there is a team of reviewers and the council members. So I think all those questions can be reviewed, and whatever is there is going to be backed up by references, and our panel of experts and reviewers will make sure. So thank you very much for that. And I think we also have a few more members. We have Dr. Jabbar Ali.
Faisal. Can I respond, Dr. Faisal? Dr.
Sir,
Faisal
please,
has made some very good.
Yes,
he has made some very good points.
Sir.
Because he is the mentor of the team, so he has got the right to make all these comments that he has made. Each time we have question, it's not this particular scenario, but most of the time we have few or one or two questions where there is always a little bit of controversy. But then when we go to the literature and references, we are bound to agree with them. But the thing is, on the whole, the team performance was not very good, given the technical reasons, given the other difficulties, all put together. Yet the team performance was suboptimal. And as Faisal has said, that we are not discouraged. We will continue our efforts. I think that's the spirit. They should go ahead with that and improve their knowledge. And definitely, if Dr. Faisal wants, we can forward those questions to him for his comments. But I think each time we have one or two such questions where there is a controversy and we think that that particular answer was not correct. But then we are bound with the references. So that's the position. So I think my message for the team that has not scored today is not to worry, not to be depressed, but to keep it up and continue their efforts. Inshallah, they will be doing good in future such matches. Thank you.
Thank you very much, sir. I'm sure they'll definitely pay heed to this. It's the competition which matters. Winning and losing is part of it. And I think we are all competing every day, rather every minute of the day. And this is what life is all about. So we do have Dr. Jabbar Ali with us. Can we have your comments, sir? All right. So we have Professor Chirag Hussain. Sir, can we have your input?
जी थैंक यू हमजा, बहुत बहुत शुक्रिया। और सबसे अच्छी बात इस टेस्ट की और इस एक्सरसाइज की ये है कि ये नॉट ओनली शेयरिंग ऑफ द नॉलेज, मोटिवेशनल भी है। और टीम ने परफॉर्म किया नहीं परफॉर्म किया अलग बात है। और दूसरी बात, मैं एक ये रिक्वेस्ट करूंगा, कंसेप्चुअल नॉलेज ज़्यादा होनी चाहिए। अगर कंसेप्ट होती है तो फिर ऐसी बहुत कम गलतियां होती है। कंसेप्चुअल नॉलेज होनी चाहिए और वो आपको टेक्स्ट बुक पढ़ने से ही आएगी। तीसरी बात जो मैं सर इसहाक साहब की बात के क्वेश्चन एक दो थे जिसपे से फॉर एग्जांपल सेकंड लास्ट क्वेश्चन था, मैं बता ही देता हूँ कि मेरा तो ख्याल था कि बीटा ब्लॉकर है। चलो उन्होंने कैल्शियम चैनल ब्लॉकर बता दी उसकी राइट आंसर, फिर उसको चेक करना पड़ेगा। जो लास्ट क्वेश्चन था दैट वाज अ मोर डिफिकल्ट क्वेश्चन, नो डाउट। वो उसमें ऑलमोस्ट पैथोलॉजी था या फार्माकोलॉजी थी, फार्माकोलॉजी या नॉट पैथोलॉजी, फार्माकोलॉजी थी। आई डोंट नो कैसे क्वेश्चन रखने चाहिए, लेकिन बड़ी बेसिक क्वेश्चन थे जो जितनी भी इन्होंने दिए थे, बड़ी जबरदस्त। उन्होंने सिनारियो भी अच्छी दी थी और उन्होंने क्वेश्चन भी अच्छे बनाए थे। अप्रिशिएटेड, बहुत टीम आर अप्रिशिएटेड। उसको वाकई उनको डिस्करेज नहीं होना चाहिए, लेकिन फिर अगेन मैं कहूँगा कि कंसेप्चुअल नॉलेज होना चाहिए। कंसेप्चुअल नॉलेज होती तो बहुत सारे क्वेश्चन हल हो जाते। थैंक यू जी।
Thank you very much,
Very
sir.
well comments made by Dr.
Very
Chirag.
good.
Excellent comments. You know, अब देखो इसमें थोड़ी लक का भी अमल दखल है ना। अगर ये टॉस में कह देते कि हम दूसरा सिनेरियो ले रहे हैं तो वो ये जो है दूसरी टीम को मिल जाता। तो इसलिए ये रैंडम सिलेक्शन है, इसमें थोड़ा लक का एलिमेंट जरूर है। बाकी नॉलेज जैसे कहा है चिराग ने, कंसेप्चुअल नॉलेज होना चाहिए, ब्रॉड बेस्ड नॉलेज होना चाहिए और बेसिक्स कभी भी नहीं इग्नोर करना चाहिए। बेसिक्स शुड ऑलवेज बी, एज लॉन्ग एज यू आर फेलोज, यू आर इन ट्रेनिंग, यू आर बिकमिंग स्पेशलिस्ट, द बेसिक cardiology, the physiology should not be ignored or forgotten.
Right, sir. I think golden words coming from our experts and our seniors. I think this is the key, sticking to the basics and doing it to the best of your ability. So we do have Professor Mansoor Ahmed. Sir, can you hear us? Your thoughts?
Yeah, I can hear you. I think very, very interesting. I think it's a textbook questions, really. And a little disappointing that even JVP, when I ask questions during examination, they're not aware of these 4 waves. So I think wonderful questions. It simply reflects that we, our youngsters, are not really reading. They are mostly discussing and they're not confirming by the books what the book says. I always tell my fellows that whatever I'm saying, I could be wrong. Always confirm it by the textbook or the literature. And I think that's what is very visible here also. The questions are very basics. Maybe, therapeutics or pharmacology of a drug, which was a very new drug, by the way. It's not something which has been established for a long time and is not even available here. So that may be said called a kind of absurd question, but I think the books are there, the text is there, literature is there, and I would insist that we should all go back to our basics, as Professor Ishaq has pointed out, and that's where you can stand on your feet only when your base is strong. Top heavy with weak base will take us nowhere. I think wonderful question. I've really enjoyed it. This is the first time I've joined this, and I'm enjoying it. And I'm not going to leave it until the end.
Thank you very much,
Thank you.
sir. Thank you. It was a pleasure having you, and we still have half of the job left. And we are going to move to the second half of the match. And can we have the next scenario on the screen, please? So it's Civil Falcons' turn, and I would request Jaguars to read the Vinay. Read the scenario, please. We can't hear Jaguars. Can you read it? L.R.H. Jaguars, can you hear me? So is your button unmuted? button of the mic. Okay, we can hear you now. Can you read the scenario?
Presently, we are following an episode of palpitations while doing workout in India. He denies any complaint of pain. He has no significant pre-morbid and denies any family history of cardiomyopathy. Arrhythmias are attended. Resting ECG, echocardiogram, and 24-hour Holter monitoring were all normal. He was advised to undergo ETT, which was stopped due to an episode of white complex.
Okay, so I believe there is some distortion at their end, so I'm going to take over. So I think he has no significant pre-morbids and denies any family history of cardiomyopathy, arrhythmia, or sudden death. Resting ECG, echocardiogram, and 24 hours Holter. Can we have it on the screen, please? And 24-hour Holter monitoring were all normal. And this is the ECG. All right, back to the scenario, please. He was advised to undergo ETT, which was stopped due to an episode of wide complex tachycardia as shown in the ECG. He felt lightheadedness and palpitations. All right, so this is the scenario. And Civil Falcons, you just have a couple of seconds to gather yourself, and then we'll move to question number 1.
Yes, we would like to see the ECG, please.
Okay, ECG, please display it. Can you see it? All right, so you can always ask for the scenario or the ECG and it should be displayed right there and then. So, can we have question number 1 on the screen, please? Right, Jaguars, can you read the question? Okay, so I think we have some technical issue going on, so I'm going to read it myself. What is the most likely clinical diagnosis? A. RVOT tachycardia. Option B. WPW syndrome. Option C. Atrial flutter with rapid ventricular rate. Option D. Atrial fibrillation with pre-excitation. Option E. Scar-mediated VT. And your 60 seconds start now.
Please show us the ECG. Thank you. Option A, alpha.
Okay, so 20 seconds to go. Option A, that means RVOT tachycardia. Are you sure? Should I lock it?
Yes, please.
Okay, as confident as they are, lock option A. Oh yes, very well done. Smartly reviewing the ECG and coming up with the right answer. And this one is a 6. And with this, we already know that you won the game. But let's see how much you score, because this will help you in the tournament. All right. So, can we have question number 2 on the screen, please? Jaguars, can you read the question now? Are they there? I can't see the Jaguars on the screen. Okay.
सर आवाज आ रही है सर?
अब हमें बहुत अच्छी आ रही है. Yes, perfect.
What treatment will you consider for this patient? Option A, ICD. Option B, beta blockers. Option C, digoxin. D, refer for catheter ablation for ventricular arrhythmogenic focus. Option E, refer for catheter ablation for caval tricuspid isthmus.
And your 60 seconds are on your screen.
We would like to go with option E.
All right.
Yes, E for
So
helping.
option C, digoxin.
Please, E.
Option
Refer for the
E.
catheter ablation.
Okay. Option E, refer for catheter ablation for cable tricuspid isthmus. Lock option E, please. Oh, so that one has been missed. Never mind. You still have many questions to go. Question number 3 on your screen. And Jaguars, we can hear you loud and clear. Please read the question.
Yes, sir. Which one of the following antiarrhythmic agent do not prolong the QT interval? Option A, quinidine. Option B, lidocaine. Option C, sotalol. Option D, procainamide. Option E, ibuprofen.
And the timer starts now.
Option B, lidocaine.
B, lidocaine. You want me to lock option B? Should I lock
Yes, sir,
it?
please.
So he has come down the wicket trying to hit over the covers. Let's see. Lock option B. Oh yes, that's a 6. Well done. Very well played. All right. So you have the next question on your screen, please. Read the question, Jaguars.
The patient was started on appropriate medical therapy and advised to refrain from strenuous activity. However, he insisted upon doing gym and asked if permanent cure was possible. Which treatment can offer him permanent cure? Option A, ICD. Option B, non-permanent treatment. And he has to be on antiarrhythmic medication. Option C, catheter ablation. Option D, lifestyle modification with avoidance of strenuous exercise. Option E, CRT.
And your 60 seconds are on your screen. Twenty-five seconds.
Option C, catheter ablation.
All right. So lock option C. Yes. Very well done. Another one for a 6. That's great going. All right. Question number 5 on your screen. Read the question, Jaguars.
Which of the following antiarrhythmic agent has the least effect on the slowing conduction through the AV node? Option A, calcium channel blockers. Option B, beta blockers. Option C, amiodarone. Option D, lidocaine. Option E, sotalol.
60 seconds on your screen.
Option D, lidocaine.
That was quick. He has come down the wicket again. Last one went over the covers for a 6. Is this going over long on for a 6? Should I lock option D? You want me to lock it? Option D?
D, lidocaine.
Okay, D, lidocaine. He's confident. Lock it. Oh, yes. Very well done. Very well done. Well played. Well played. So, they seem to be knowing what they are doing. Good job. So, can we have question number 6 on the screen, please? Jaguars to read.
One of the following agent is least likely to cause prostate point. Option A, quinidine. Option B, procainamide. Option C, flecainide. Option D, ibuprofen. And option E, sotalol.
Okay, your timer starts now. Okay, so Jaguars, when you touch the mic, I think we hear distortion. So I will request you not to touch the mic. Thank you. And we have 20 seconds left now.
Option D, Abutolite.
Okay. Not as confident as he normally is. He wants us to lock option D. Lock option D, please. Oh, yes. So that's a miss. It was a close one. But never mind, you're doing good. Can we have question number 7 on the screen? Read the question.
The patient was started on beta blocker, but he had persistent symptoms. He refused catheter ablation and asked for any other medical therapy other than beta blocker. Which other therapy can be started in his case? Option A, procainamide. Option B, sotalol. Option C, amiodarone. Option D, flecainide. And option E, abutolite.
And your 60 seconds start now.
Option C, amiodarone.
So we have 12 seconds now. Come on, 10 seconds.
C, amiodarone.
Okay, C, amiodarone. Lock option C. Oh, that turned out to be a googly, I would say. A loopy delivery, turns the other way and missed again. All right. Can we have question number 8 on the screen, please? Read the question.
ICD is recommended among patients with persistent low EF less than 40%, post-MI for primary prevention of VT and subsequent sudden death. How many months or days following revascularization post-MI should we wait before an ICD implantation is contemplated among such patients? Option A, 1 month. Option B, 2 months. Option C, 3 months. Option D, 4 months. E, 40 days.
And the timer starts now.
Option C, 3 months.
Are you sure? He's come down the wicket again. You want me to lock option C?
Yes, please.
Okay, he's very confident. The whole team looks confident. Lock option C. And yes, they know it. Well done. Well played. Very well done. And that puts a score of 30 on the board. And we still have 2 more questions to go. Question number 9 on your screen. Read it.
According to 2018 revised 1 Williams classification of antiarrhythmic drugs, which agent is placed in class 0 group of antiarrhythmic agent? Option A, nicorandil. Option B, adenosine. Option C, ivabradine. Option D, scopolamine. Option E, ajmaline.
And your timer starts now. So is this a Yorker? Let's see. Approaching 25 seconds. 20 seconds. We don't hear them discussing anything, I guess. Civil Falcons. 13 seconds. 10 seconds. Come on. Falcons. 5.
Option B, adenosine.
All right, they want us to lock option B, adenosine. Are you sure? You're confident?
Not sure, but we have to go
Not
with
sure,
something.
not confident. Let's see how you play when you're not confident. All right, lock option B, adenosine, please. Oh, yes, when you're not confident, you get it wrong. Never mind, never mind. Well played. And we're moving to the last question. Question number 10. Read it, please.
He further undergoes 48 hours Holter monitoring, which shows frequent VPCs. Which one of the following PVCs? Sorry. Which one of the following clinical scenario is most likely to be associated with a PVC-induced cardiomyopathy? Option A: 4% symptomatic PVC burden from the anterolateral peptide muscle of the LV. Option B: 8% asymptomatic PVC burden from the posterior vesicle. Option C: 21% asymptomatic PVC burden from the LV summit. Option D: 5% symptomatic parahesian PVCs with diurnal variation. Option E: 2% PVCs burden from the right ventricular outflow with exercise only.
And your timer starts now. 60 seconds on your screen.
Hamza, this is a tough one.
Yes, sir, it certainly is. Let's see. I'm hoping for a 6.
Option D, delta.
All right, so you want me to lock option D, delta. Right?
Yes, please.
Are you confident? So they are not confident again. Let's see what happens. Option D to be locked. Oh, the trend continues. Again, the team's not happy, but yes. So we come to the end of this innings, and what we have is a score of 30, a score of 30 rather out of 60. So they got half the questions right. 5 questions were correctly answered. It definitely was a low scoring game today, but from the first question onwards, we knew who the winner was. But I would definitely say L.R.H Jaguars. They're a good sport, and I'm sure they're going to bounce back much stronger. It's all a learning experience for everyone. So congratulations to Civil Falcons. Commiserations to our L.R.H Jaguars, but they'll be back with a bang. I know it for sure. And we have our umpire of the day, Professor Ishaq Saab. His comments are always extremely important.
Thank you, Hamza. Once again, a very interesting match. And unfortunately, one team couldn't score, but never mind. The second question was very interesting with a lot of pharmacology. And they did very well. They missed a few questions. You know, once you did the first question right, then it was very easy for them to follow because the answer to all the subsequent questions were in the first question, which they did rightly. Percentage questions are always quite difficult one, but again, 1 or 2 questions are always going to be difficult. 50% average, 1 or 2 very easy, and at least 2 or 3 a bit difficult. So that's how the composition is in any paper for any examination. So you can't have all difficult, you can't have all easy, you can't have all average. So I think it's a test of knowledge. And as Professor Mansoor has said that he has enjoyed, we have all enjoyed. I think I haven't missed a single match. One gets addicted to this as a ritual. So I hope our colleagues will continue their contribution. Congratulations to the winning team. obviously they did well, and I think pharmacology is very interesting. Antiarrhythmic agents and their classification and their specific effect on a particular pacemaker component is extremely important to understand the electrophysiology of the heart. So I think all the questions that we had so far in the tournament are very relevant, very clinical, and uh, something that all the trainees should have known. So with this, I think thanks to all the worthy colleagues that have joined today for the first time. I hope they enjoyed. Unfortunately, today we had a lot of technical issues, and I'm sure the uh, technical team will make sure that in future we don't experience such things which hamper the performance of the team. Uh, with this, I think I would like to once again congratulate the winning team. Thank you, Hamza,
Thank
for
you
your
very much,
excellent
sir.
moderation as usual.
Thank you very much, sir. It's always a pleasure. I think addicted we are to the show. And as they say, we had some technical issues, but still the show must go on. So we have our other umpire.
Hamza, can you hear me?
Yes, is this Dr. Jabbar? Jabbar Ali, yes, sir.
Yeah.
I can hear you. It's great to have you.
Thank you very much. Sorry, I was in traveling coming from Islamabad. I was there for intervention exam.
Yes, sir.
First of all, congratulations to the winning team, and L.R.H did very bad. There is no excuse for that. But I'm sure we will look into this, and we will sit to the resident and to the supervisor. We will sort out the matter, and hopefully next time we will do best. And it is always, for me, great to listen to Professor Ishaq. He's not only a teacher, but a lot of respect and regard. And actually, he's my inspiration as well. So great team, great moderation. And unfortunately for L.R.H, they did very bad. There was no excuse of one or two questions. They missed all the questions.
Right, sir.
Thank you.
Assalamu alaikum, Jabbar.
Assalamu alaikum, sir.
You need to take this L.R.H team to Chersi Tikka and feed them, you see. So they...
Sir, they had Chersi Tikka on probably on Wednesday.
So
Wednesday
maybe that
Thursday.
is the after effects of Tikka, you see.
Yeah, that is the effect of Chersi Tikka.
I think this time you should take them for brain masala.
Yeah, they need brain masala.
Very right, sir. I think interesting. Definitely, it's always great to have all of you here, sir. And I think Professor Ishaq, he's an inspiration for all of us. And I think these youngsters are so lucky to have this interaction with so many seniors and stalwarts of cardiology and interventional cardiology. It's always great to have them. And we are all learning. It's not only the candidates. I think everybody is learning from this show. We all take home a lot of technical, theoretical details, and we have a lot to ponder upon. And it's always great to have you, and I hope to see all of you in the show more often. So with this, who's this, please?
Dr. Rauf here.
Yes, Dr. Rauf, please, your input, sir.
हमजा बेसिकली मैं तो इसमें सिनारियो बनाए थे, लेकिन आई डोंट नो कि पहली दफ़ा मैं आया हूँ, तो तीन मेरी अपने नॉलेज के लिए मैं पूछना चाहता हूँ कि क्या जो कंटेस्टेंट हम इसमें शामिल कर रहे हैं, तो उसके लिए कोई क्राइटेरिया है कि फर्स्ट ईयर की कार्डियोलॉजी टीएम हो, सेकंड ईयर का हो, थर्ड ईयर का हो, कि नहीं बस रैंडमली हम सिलेक्शन करते हैं? दूसरी ये कि क्या जो सिनारियोज हमने बनाए हैं, क्योंकि जो सिनारियोज मैंने देखी, अगर एक टॉपिक इसाक साहब ने कहा कि अगर आपने एक क्वेश्चन टिक किया और उसकी नॉलेज हो आपको, तो वो आप सारे क्वेश्चन मेजॉरिटी टिक कर सकते हैं। मेरे ख्याल में जो अनफॉर्चुनेट थिंग थी इसमें कि हुक्म L.R.H वालों ने नहीं पढ़ा था सही तौर पे, तो उस पूरी 10 क्वेश्चन जो है उसने मिस कर दी। तो क्या हम टॉपिक्स देते हैं या एज ए जनरल हम जहाँ से भी वो उठा सकते हैं उनको दे सकते हैं? और क्या ये इसी तरह सिनेरियो पे चलेगा कि नहीं, हम जो है हर क्वेश्चन के लिए अलग सिनेरियो बना के पेश कर सकते हैं, क्योंकि इसमें चांसेस ऑफ एरर कि एक टॉपिक आपने नहीं पढ़ा तो आपका पूरा सिनेरियो चला जाता है. सो दीज आर फ्यू क्वेश्चंस, क्वेरीज थी, शायद आप लोगों ने एड्रेस की हो लेकिन मुझे पता ना हो. थैंक यू.
Can I answer this,
Right,
Hamza?
sir. Yes, sir. I was going to come to you. Please, sir. Go ahead.
रोहू साहब की बातें ठीक हैं अपनी जगह, लेकिन होता ये है कि सिनेरियो का मतलब ये है कि जितने भी सब्सिक्वेंट क्वेश्चंस होंगे वो रिलेटेड टू दिस सिनेरियो होंगे, और अगर आप सिनेरियो को अच्छी तरह अंडरस्टैंड करें तो देन इट विल बी पॉसिबल फॉर यू टू अटेम्प्ट दी क्वेश्चंस पॉजिटिवली. इस तरह नहीं हो सकता कि हम 10 इंडिपेंडेंट क्वेश्चन दे दें, देन सिनेरियो का देने का फिर कोई फायदा ही नहीं है. These 10 questions are relatively independent, but they have got a link with the scenario. So the whole idea is scenario, read the scenario properly, understand the scenario, and then answer the questions that are coming and linked with the scenario. And as far as the teams are concerned, I think it's up to the mentor to select the team for the match. So I think we don't have any criteria. The criteria is laid by the mentor. जो टीम आती है उसके जो मेंटर होता है वो देखता है कि इसमें मेरे सेकंड ईयर फेलो हो, थर्ड ईयर फेलो हो, फोर्थ ईयर फेलो हो, जो भी है, एंड सो दे आर selected by the mentors as far as I know. Questions are made by a particular committee, and then they are reviewed by another committee. So there is a lot of check and balance, but still there's always a room for error, and this is what the exam is. So I think on the whole, so far, there has been no major technical or scientific objections to the context of the questions and the answers. So इक्का दुक्का क्वेश्चंस के ऊपर हमें भी थोड़ी सी हैरत होती है, but then some of us are very senior, our knowledge is not up to date, and then when we go and refer to the literature and books, then we correct ourselves. So इसमें देखें हमारा लर्निंग भी हो रहा है और उनकी लर्निंग भी हो रही है. So I think it's a blend of both difficult and easy questions, and I think the best thing is to understand the scenario properly.
Thank you, sir.
Hamza, can I respond?
Hamza, can I have Dr. Faisal here?
Okay, please. Is this Dr. Jabbar?
जी जी हमजा, जो रऊफ ने पॉइंट्स रेज किए हैं इसमें देखिए, जो मैं एल.आर.एच वालों को, चूंकि मैं एल.आर.एच में हूँ, मोस्ट ऑफ देम आर सीनियर थर्ड ईयर ऑफ रेजिडेंट है, तो दैट इज नॉट एन एक्सक्यूज. और दूसरी बात ये है कि एटलीस्ट दे शुड नो अबाउट हुकम्स, वेदर इट इज टेकन रैंडमली और प्रायरली सेलेक्टेड, तो वो तो कोई इशू नहीं है. इशू है कि दे आर नॉट प्रिपेयर्ड. And I am working in L.R.H for the last 15 years. I think they have done the worst. We have never done worse than this. तो हम एक्सेप्ट करना चाहिए. अब एक्सेप्टेंस, अगर कोई फेलियर है, फेल होता है बंदा, लेकिन अगर हम उसको ऐसे ही छोड़े, दैट विल बी अ बिगर फेलियर. आई थिंक वी हैव टू लुक इनटू दिस एंड सिट विद देम, इनके इशू पता करें, और जहाँ पर है जो शॉर्ट कमिंग है, वी हैव टू ओवरकम.
Very right, sir. I think you're absolutely right.
This is Hamza. This is the positive
Hamza,
approach and the sportsman spirit.
Yes, very right,
Hamza?
sir. I think is it Dr. Malik Faisal?
Malik Faisal.
Right, sir. Please go ahead.
Hamza, first I would like to congratulate the team who have won. They have performed very well, and from L.R.H Jaguar side, yes, they had performed not to the mark, not to the standard that is laid by our unit by themselves. We'll sit. I agree with Dr. Jabbar. We will sit with them and we'll see what the problem is. And I would like to ask that will this match be continue, or we'll have another matches too along with that, because we are preparing for this whole series, I guess. So with the spirit of that will continue, and we'll continue to work hard. And next time you will see the L.R.H Jaguar team having a score of very good, and which would be the top on the scoreboard team, inshallah.
Right, sir. Thank you very much for the input. So I would like to tell you that these are the league matches, and your team is definitely going to have another match in the league. So they have the chance, in fact, all the chances to bounce back. So I think nothing has been, all is not lost yet. And as Dr. Jabbar has said, and you yourself and your whole team, I think this is where they can have a wake-up call, and I'm sure they'll come back stronger, and we look forward to that. It's a learning process, and we are all learning a lot. And already Saag Saab has explained the whole process in detail. We do have the other umpire, our other umpire, which is Professor Abdul Hamid Siddiqui. Sir, your thoughts, please.
Can you hear me?
We can hear you.
Okay, I think I'll tend to agree what Professor Ishaq has said and Dr. Jawar and all others have commented. I think really the L.R.H should have answered at least one or two questions. Anyway, it all requires concept. We all know that we don't see very commonly these cases, but as a cardiology fellow, they should have at least some knowledge of that, because that is going to be asked. At least that can be easily asked in the paper, in the theory as well. And sometimes there is long case as well in the clinical cases when they go for the exam. So anyway, very good formulation of questions, and I think all support for the Jaguar team to get themselves more prepared and hope for the best. Thank you.
So thank you very much, sir, for your input. I think we had an interesting session, interesting discussions, but it's always the end result which is there, but I think it's the process which is important, and the idea of this league is to improve our clinical as well as theoretical knowledge. I think Wilson Pharmaceutical and Pakistan Cardiac Society is doing a wonderful job in that respect, and we will see the best of L.R.H Jaguars for sure in the coming matches, and we are hoping for that, inshallah. But the news from the center today is that Civil Falcons have done well and they have won the match today. And the paucity of time, I'm now going to come towards the end of today's session, today's match. So hope to see you in the next game, and it's always a pleasure to be a part of the show, and I hope that next time we'll have the next match, which is going to be another clash of the titans, another good game, a close game, because that's what we all come here for, and we are always excited to be here. So thank you very much for your time. It was a pleasure hosting you all. Until next time, Allah Hafiz.